definitely want to start. Liza.
Maybe we should just go ahead and start. I think we're all back.
I believe we're all back.
Okay.
Do you want me to pull up the Shareback?
Yes.
Okay, I can do that. I'm gonna try to share my screen.
Okay.
Are folks able to see? Let me try to visualize it. What were you able to see?
Okay. I think we'll take a few minutes. We have another Padlet. I think we're all coming back sort of slowly from our panels. I'd like to ask the panelists if they are still willing to sort of stay on camera while we sort of have this discussion. They're welcome to. And we really just wanted to bring everybody back together. So some of us, of course, we weren't able to be in 3 places at once, but these conversations should happen in the same room in some ways, because I think so much of this work really needs to be, sort of cross-cutting and talking and learning from each other, from these perspectives of people who work in the research space, the clinicians who work in the clinical space, and caregivers who are caring for our community. And so we wanted to, we thought it'd be, it's been a lot of information to sort of take in. We would love it if people could share on this Padlet using the link. If you could reflect upon maybe one thing that you learned today, and that we could sort of, have a discussion about some of the main themes around some of these things shortly. So I don't know if we want to just play a little more music for about 5 more minutes and then come back to the discussion.
ਜਿੱਦਣ ਦੀ ਮਿਲੀ ਜੱਟ ਨੂੰ ਕੁੜੀ ਕਹਿੰਦੀ ਜੀ ਨਹੀਂਓ ਲੱਗਦਾ ਲੱਗਦਾ ਇਸ਼ਕ ਹੋ ਗਿਆ ਤੇਰਾ ਵੀ ਨਾ ਲੱਗੇ ਤੇ ਮੇਰਾ ਵੀ ਨਹੀਂਓ ਲੱਗਦਾ ਕਹਿੰਦੀ ਕਿੱਥੇ ਆ ਫੋਨ ਚੱਕੋ ਜੀ ਬੇਬੀ ਮੇਰੇ ਲਈ ਵੀ ਥੋੜਾ ਟਾਈਮ ਰੱਖੋ ਜੀ ਕਹਿੰਦੀ ਕੱਢ ਲਓ ਜੀ ਟਾਈਮ ਹੁਣ ਮਿਲੋ ਕਹਿੰਦੀ ਸਾਡੇ ਨਾਲ ਪਿਆਰ ਤੁਹਾਡਾ ਦਿਲੋਂ ਜੀ ਕਹਿ ਕੇ ਗੱਲ ਕਰਦੀ ਦੱਸਿਆ ਮੈਂ ਲੱਗਦਾ ਜਿੱਦਣ ਦੀ ਮਿਲੀ ਜੱਟ ਨੂੰ ਕੁੜੀ ਕਹਿੰਦੀ ਜੀ ਨਹੀਂਓ ਲੱਗਦਾ ਇਸ਼ਕ ਹੋ ਗਿਆ ਤੇਰਾ ਵੀ ਨਾ ਲੱਗੇ ਤੇ ਮੇਰਾ ਵੀ ਨਹੀਂਓ ਲੱਗਦਾ ਕਹਿੰਦੀ ਤੇਰੇ ਲਈ ਮੈਂ ਚੇਂਜ ਕੀਤਾ ਦਰਜੀ ਕਹਿੰਦੀ ਲਵ ਆਇਆ ਰੇਂਜ ਤੇਰੀ ਮਰਜ਼ੀ ਕਹਿੰਦੀ ਨਾਮ ਤੇਰਾ ਗੁੱਟ ਤੇ ਕਹਿੰਦੀ ਵਾਦਾ ਮੇਰਾ ਦਿੱਤੀ ਤੇਰੇ ਨਾਲ ਕਹਿੰਦੀ ਪਤਾ ਤੇਰੀ ਮੁੱਛ ਦਾ ਸਵਾਲ ਆ ਕਹਿੰਦੀ ਮੈਥੋਂ ਨੇੜੇ ਤੇਰਾ ਤੈਨੂੰ ਟੂਲਾ ਕਹਿੰਦੀ ਤੇਰੇ ਹੱਥੋਂ ਜ਼ਹਿਰ ਵੀ ਕਬੂਲ ਆ ਯਾਰਾ ਨਾ ਤੇਰੇ ਨਾ ਸੁਣਿਆ ਮੇਰੇ ਲਈ ਤਾਂ ਦੇਖਿਆ ਤੂੰ ਕਦੇ ਵੀ ਫਰੀ ਨਹੀਂਓ ਲੱਗਦਾ ਜਿੱਦਣ ਦੀ ਮਿਲੀ ਜੱਟ ਨੂੰ ਕੁੜੀ ਕਹਿੰਦੀ ਜੀ ਨਹੀਂਓ ਲੱਗਦਾ ਲੱਗਦਾ ਇਸ਼ਕ ਹੋ ਗਿਆ ਤੇਰਾ ਲੱਗੇ ਤੇ ਮੇਰਾ ਵੀ ਨਹੀਂਓ ਲੱਗਦਾ ਕਹਿੰਦੀ ਕੁੜੀਆਂ ਤਾਂ ਹੋਰ ਵੀ ਨੇ ਔਜਲੇ ਕਹਿੰਦੀ ਮੋਰ ਵੀ ਨੇ ਚੋਰ ਵੀ ਨੇ ਔਜਲੇ ਕਹਿੰਦੀ ਮੈਂ ਤਾਂ ਬਸ ਸ਼ੱਕੀ ਜਹੀ ਹੋ ਜਾਵਾਂ ਕਹਿੰਦੀ ਉਹ ਤਾਂ ਗੁੱਸੇ ਖੋਰ ਵੀ ਨੇ ਔਜਲੇ ਕਹਿੰਦੀ ਲਿਖਣਾ ਤੂੰ ਮੇਰੇ ਕੋਲੋਂ ਸਿੱਖਿਆ ਹਾਏ ਉਹ ਪਰ ਅੱਜ ਤੱਕ ਮੇਰੇ ਤੇ ਨਹੀਂ ਲਿਖਿਆ ਕਹਿੰਦੀ ਕੋਈ ਨਾ ਤੇਰੇ ਨਾਲ ਹਾਏ ਉਹ ਮੈਨੂੰ ਪਤਾ ਤੇਰੀ ਮੁੱਛ ਦਾ ਸਵਾਲ ਆ ਤੇਰੇ ਸਾਰੇ ਯਾਰ ਸੈੱਟ ਨੇ ਇਹਦਾ ਹੁਣ ਕਦੋਂ ਸੈੱਟ ਆਊ ਆਉਂਦਾ ਹੀ ਮਿਲੀ ਜੱਟ ਨੂੰ ਕੁੜੀ ਕਹਿੰਦੀ ਨਹੀਂਓ ਲੱਗਦਾ ਤੇਰਾ ਵੀ ਨਾ ਲੱਗੇ ਤੇ ਮੇਰਾ ਵੀ ਨਹੀਂਓ ਲੱਗਦਾ ਜਿੱਦਣ ਦੀ ਮਿਲੀ ਜੱਟ ਨੂੰ ਕੁੜੀ ਕਹਿੰਦੀ ਨਹੀਂਓ ਲੱਗਦਾ ਇਸ਼ਕ ਹੋ ਗਿਆ ਤੇਰਾ ਵੀ ਨਾ ਲੱਗੇ ਤੇ ਮੇਰਾ ਵੀ ਨਹੀਂਓ ਲੱਗਦਾ
Are we starting back again?
Whenever you're ready.
Do people feel they have enough to work with? I'm like still writing.
Yeah, I guess we can see our folks still trying to summarize some of your thoughts into the Shareback. We can give folks more time. If not, we can also engage in the conversation. Sorry, since I'm sharing screen, I can't see anyone, so I'm gonna try to move my chat screen over here so I can.
Okay, Han, let's start. Why don't we start now? Sorry, not to be so abrupt about it. Yes, thank you so much, panelists who have stayed on. We love the idea of continuing the discussion with all of you. And actually looking at the Padlet, I can see so much similarities in a lot of the discussions that we all had in our own spaces. Thank you, Cindy, for pulling that up. And I could I thought maybe each of the facilitators could give sort of a quick, maybe a quick summary from some of these reflections. I would say coming from the research panel, which I thought was a really, really fruitful, wonderful discussion with people who really come from some different spaces in research, and none of whom want to consider themselves academics or researchers, because I think so much of that term in some ways, doesn't like the decolonization of that work is really to sort of reject, the system that is the research game that we sort of play to maybe get the funding to publish, to work with the people that we want to work with or to keep our jobs. But that, that there's so many ways that we can try to deconstruct the work we do, like in talking about how, when somebody says that, this is objective, it's not necessarily objective. It might be just coming from really just a white male gaze, and that these biases exist in the research, and how important it is for maybe more AAPIs to bring their perspectives and their where they come from into the research to help decolonize it. And thinking about, yes, how that liberation is collective, and that we need to include AAPI in the research. AAPIs need to also be doing the research. We know that that's so important. We also kind of continued our conversation to really talk about how, sometimes what the data is collecting and how it is, does not reflect our communities. It also does not take into account so much of the cultural context of our communities, and that so much of what we really feel is that it would be better as far as communicating would be qualitatively telling stories, really just taking this information from different points of view so that people can it resonates with people, which is totally something that I think we've seen here, that it's not really sort of where we find it in the real quantitative data, but that we find it in the qualitative work and the stories behind the people, and how that is where we'd like to see research really go, and how we'd like to uplift that more so that that can be the larger standard. And then I'll move over to Han. Do you want to talk a little bit about how the clinician panel discussion went?
Oh gosh, I feel so full. I feel so full and grateful to be in the spaces with other folks who care about our collective healing. Someone in the comments said, I want to build a ukulele, play, and then cry wholeheartedly, because that was one of the suggested practice on looking at how we can be more connected to our ancestors. Kali'i had to leave, but they said we are a direct reflection of our ancestors. And there was more to that quote that I couldn't write down fast enough. But some of the conversations we have was really framing it in this kind of system thinking too, of talking about decolonized health, on how has imperialism, colonialism, land theft, enslavement, war and genocide and displacement has had us like be here right now in the US, right? And how did those systems set up in a way that has not been for us, right? And the healing that we have to do because of our ancestral grief and rage and anger and trauma and intergenerational trauma, that folks here have some of the power and gatekeeping to do so in a way that we are not also perpetuating more harm, because we have been I want to say like almost indoctrinating the system, because that's how we got our license, that's how we got our job, our professionalism, right? So really working towards an ongoing process, right? To unlearn some of those things that we have learned almost on the clinical level, and bring in these kind of relationships to our land, to our people. And I'm going to read some of the things that folks wrote on here, because I thought it was so great to like, how do we be here and now, right? Bringing back rituals, bringing back ancestral practices, connections to the season. I believe Viva brought that into us. Find joy, find our spirits, find our community and our space, whether it's from cartoons to comics, right? To whatever fun things that we can do in our space, to drama and music. I think there are so many ways that we can work with folks on I guess like an individual level or community level on reframing what it means to really heal, collectively heal in this space too. I that's gonna be my short summary, but I do feel really full and very honored to be in the spaces with folks in the clinical panel. And I'm if we are gonna invite folks in later to come in. But I'm gonna pass it to Lynn. How is this?
Hi everyone. So I took some notes when we were talking about the panel, and I think some of the things that we touched upon was this idea of inclusion, and also like how different systems intersect, different systems that don't take in AAPI caregivers. And one of the biggest thing is that although like different professional organizations and also like the US Health Department also recommends integrating caregivers into care, clinicians often are not trained, or don't know how to, or don't want to. And so we were talking about like the changes in the AAPI population, right? Between first generation and second generation caregivers, and often how the immigration itself is traumatic. We lose our community, but at the same time, we find community in each other. And that has a lot to do with the 1965 Act and how removing those quotas allowed for these ethnic communities to form and finding spaces to do those kind of stuff, right? And this idea of like family obligation, how like we give so much, and you know we want to do all that we can for our family members, but at the same time there's this also this model minority myth that says like we actually don't need that help, right? And we see it in like programs that actually don't really fund families to be involved. We see it in also a lot of research done on drugs are done on white males. So it doesn't factor in differences in metabolizing in the Asian bodies, right? So also the fact that when people are recruited for research, methods that are, or it's not thought about how we should recruit API caregivers, right? We also have to fight for all these things. And we're just talking about all these ways that these intersect. And it was very telling that like I asked to ask the panelists to give me an example where they felt included. And they all like share faith-based organizations, support groups, but none of them could actually name a clinical space where they were like part of it and seen as like value for the knowledge, right? So it's inclusion is also like switching the power where like we're not being told like you don't understand, you're just schizophrenic mother, right? That because we do hold a lot of knowledge, and the fact that insurance companies don't see it, clinicians don't see it, we are not valued for knowledge, we don't get paid to share our knowledge, right? A lot of my panelists volunteer to talk to med students, but they're not being compensated for that as well. Just some ideas. And I feel like my panelists are here, and feel free to jump in if I forgot anything.
Thank you, Lynn. Thank you guys for just going through some of the many different conversations we had. I want to open the floor a little bit to any of the panelists who might have any thoughts.
I would like to address a wide gap in services for serious and persistent mentally ill consumers and their family members. The needs of the serious and persistent mentally ill, the major depression, bipolar, schizoaffective schizophrenia, is very unique and different. The clinician who treats them needs to be trained in what are city, municipality, county-wide, statewide, and federal resources. Most clinicians are trained to, the whole model is based on the fact that everybody lives in Upper West Side, Upper East Side, Westchester, and is self-sufficient. A clinician needs to know how to help somebody's basic needs met, such as rental assistance, food stamps, or apply for New Jersey or New York Medicare, and what are the not-for-profit organizations that help people in so many capacities, and what kind of peer-based programs are available. Also, local also be able to collaborate and network with local law enforcement, local emergency rooms, and local state and community-based case management agencies. And how do these programs work? Most of the private practitioners that I have dealt with do not know this. The good ones refer them to me so I can help. But there should be training. We cannot have this schism between the worried well and the serious and persistent mentally ill. I mean, if you're going to be a doctor, are you going to say that I will only treat people with common cold, but if you have cancer, go to hell? You know, you're on your own. So this kind of a discrepancy needs to be openly talked about. It's like an apartheid within our own community, and we have to fix it. We have to address it.
Biba, I think you have something to add. I saw your hand raised.
I did. Thanks, Parantap, for that. Really important. I'm in private practice, and I was like, "Yep, like that. We do that." I think my comment was, I don't think it was really that related, but we had this question on our clinician panel about that we didn't get to address around, like, for people who are trying to explore their own decolonization or their own anti-oppression lens, like, what are some maybe tips or wisdom? And I think something that came up for me while I was thinking about this is, for anybody who's here who's like exploring this, is like to have a lot of I live by a train, tenderness and care for yourself as you're exploring this work, because I think Dr. Hom and lots of other people talked about how much grief there is in trying to explore this work. And I think sometimes in our social justice like communities, there's a way of evaluating, like, how woke am I, or you, and I think that creates some harm, like for ourselves and for other people. And so in thinking about the harshness of colonization and the ways that we've embodied that, can we counteract it with like a lot of care and tenderness for the process that we're in trying to explore how to decolonize. So that, I think that was the one thing that I felt really like, oh, I really want to share this.
Thank you, Biba. I appreciate that. Does anybody else have any thoughts?
Oh, sorry. I want to say one thing. Oh, can you hear me?
Yes.
I want to say, I don't know most of you actually, but I just want to say, I thank you so sincerely for people who have stayed in the mental health field for so long. I worked in it for 3 years and I left. I was like 21 at the time, so I didn't know what was coming my way. But the stigma that you have to deal with, and like the constant gaslighting, even in the medical community, about how it's considered a lower, profession, that's something I feel like we need to discuss, right? So I know how, I'm not even licensed, but like I got a taste of how tough it is. So like I really do thank this community and everyone working in it and your persistent efforts, because it is definitely needed, even if it's not articulated all the time. So thank you.
I'm wondering, since we're about to wrap up and everything, if like one question that we didn't get to in our panelists with our panel is like, what keeps us going despite all this, right? Like, how do we have hope? And I know that not all the panelists are left, but actually there is a question, but after the question, maybe all the panelists could share in 30 seconds what gives them hope and what helps them still persist in this type of work that they're doing. But I think Yao, do you have your hand up?
Yes. Can you hear me? Yeah. Thank you very much. I don't know how I get the email from your symposium. I consider myself a professional volunteer. I graduated from National Taiwan University Department of Psychology, but in the States, 50 years, I have been doing I said it's underground counseling all my life. And I coordinate monthly mental health workshop at the Tzu Chi Foundation, Flushing, New York. Tzu Chi Foundation. Recently, especially this pandemic years, a lot of personal calls for help. And I also, the reason I attended this symposium is I like to get connected to the clinicians. I can refer to people who, call me up. So I got a few email already. Thank you so much. I'm also a mindfulness-based stress reduction official teacher. I wonder if in your clinical work, anybody involved in the mindfulness-based stress reduction programs? Thank you.
Does anybody want to answer that question about mindfulness? I think a lot of clinicians do integrate mindfulness in their work.
Thank you so much for joining. We're happy to have you here.
Maybe we could just go with the panelists now and one thing they want to share. I could call out people like 30 seconds, okay? I'm going to start with Biba because you're the first square on my computer.
I think what keeps me going is community. Is like making sure I'm not isolated from other people, making sure that I'm connected to other folks doing the work, because I think when you're alone, it's really hard. It can be really discouraging. And so just making sure I'm with folks who are trying to do similar work. And yes, Bo, I do use mindfulness in my practice as well. It's really helpful for a lot of clients, not all, but for a lot.
Thank you, Biba. Saba from the caregiver panel.
Good. Thanks, Len. So for us as a family, we have very open conversations and also with our friends, and being there for others, no matter how small or big the challenge is, and also enjoying every moment and living with purpose is something. And we also do meditation and mindfulness. Living.
Thank you, Saba. Pratap?
Yeah, I have embraced the parallel process that there is suffering, there is pain, there is helplessness, and there is a burden we all carry as caregivers, sometimes as empathic providers. And we need to balance it with self-care and with a community where we recharge each other, empower and support each other. Finding the right balance took me almost half my life, but I've got it now. I can have my daughter in the hospital and I could go for a hike with my friends and laugh and joke. And I can balance both out. They both are the yin and yang. If I don't go disconnect and recharge, I cannot be there for my daughter in an empathic, compassionate way. So preventing burnout is the work all of us need to do.
Thank you. And also I forgot to mention Biba's on the clinician panel, so you can see where people are coming from. And then Grace from the caregiver panel. You're muted, Grace.
I feel by participating and giving back is what keeps me going. When I say participating, I really mean to be involved, to educate ourselves, to help other families going through the same, traveling on the same journey, similar journey, and also taking care of ourselves physically. And it doesn't have to be anything fancy. You know, you could join gym or go get a personal trainer. But for me, just walking daily outdoors with my dog and my good friends for an hour or two always help me uncompress And during the walk time, when I'm with friends, we can talk about so many things. I can talk about my daughter's illness or actually my interest. And, you know, there's always something that lift up our spirits. So I think, you know, taking care of ourselves is the most important thing. And then being involved and giving back. It's surprising being involved and how much we get back and how much support we get from the people we have supported. When I go through difficult time, they can sense it and they'll give me a call or text me or say, let's go to dinner or lunch. These are all so important. And personally, I love museums. So when I need to distress, I go to museums. Those are my little thing. And I, of course, family members. I love seeing my grandbabies when they come visit. It's just totally different world. And I, you know, I have a wonderful daughter who supports my ill family member as well. So I think that's all important. So take care of ourselves is probably the top thing.
Thank you. I think John from caregiver panel, and I think we have 2 other panelists left, Tristan and Daniel. And I think we're done unless I missed any other panelists. But John, go for it. You're muted, John.
I think my experience is similar what Grace and Sava already shared. That I remember in the family care panel, there's a question like in the most difficult time, what keep you going, right? I feel that is they reach out, not feel alone, and when I participate, I know there's some other families experiences either similar or even worse situation that I'm facing, and they are hanging on. They are not giving up. Right? And I said, well, if they can do it, and I can do it too. Right? That's a sense of not giving up and see hope from your own family strengths and from the strengths of other families that keep you going and never give up and never give up hope. And in terms of, I do agree, self-care is very important. And each one, we have different way to temporarily release us from the stress. For me, is I like to go to gym. I do that, and I ride a bicycle and be part of nature. Just sometimes just go by myself, even go by myself in the rain, get soaked in the rain. That help. And another way to escape is I love my work, I love my job, and I'm working in higher education as a faculty. A lot of my interaction with my students, with my graduate students, is very inspiring and that rewarding. Yeah.
Thank you, John. Tristan?
Hello, all. So to answer those 2 questions quickly, I do incorporate mindfulness practices into my clinical work. It's not my main modality, but I do incorporate it. And I definitely agree with everyone in terms of self-care and things that help me stay in the field. But I also do want to include finances. Money is important. I spoke a little bit about guilt and shame in our panel, and you know, money brings all of that. So I want to say I'm getting paid what I feel like I need to be paid. And I think that's something that we all need to be able to navigate through and figure out what that means for ourselves.
Thank you, Tristan, from the clinician panel. And I think last is Daniel from the clinician panel. Are there other panelists left? Han and Liza, just look around, but I think Daniel's the last one. Don't disappoint us, Daniel. You're like the last word.
I'll try not to, but I'll lean into the possible shame of disappointing you all. I do practice mindfulness in my work, but I'm not an MBSR instructor or sort of official practitioner or whatever, but it is very useful. And in terms of how I keep myself going in this field, I will say I cannot keep myself going. It's quite literally impossible for us to do it alone. And, and even thinking about how I answer this question is wondering how I've been decolonized to think I can do it alone. I've been colonized to think that I can. I want to decolonize that. And so recognizing, my sources of what sustains me, whether it's from myself, whether it's from my environment, whether it's from the people I connect with, but also recognizing the sources that are actively trying to harm me in this journey. And so then I think about these kind of buckets and pillars of where I can draw my strengths from. And I think about what can offer me gentleness, what can offer me relief, what can offer me nourishment, what can give me a sense of meaningfulness, what can really help with a sense of freedom, right? So when I think about those kind of 5 buckets, then I can have different activities, different thoughts, different people, different environments to engage in that can really allow me to keep going. And at any point in time, those resources within those buckets will go. So during my panel, I did talk about cartoons, comics, cuisines, and community, and that is a big part of it. And that means thinking about resistance, thinking about never repeating genocides again, thinking about really finding joy and fun and liberation in all sorts of ways. So doing it on my own as a homebody who actually loves wintertime, because I can say no to a lot of things and people, but then still being able to do it virtually and also in person is really key. And making sure the environment I work in, like workplace, that we spend like 40 hours plus in is suitable enough for me to keep going with the supports that I have. And if not, trying to change it on some level.
Han, do you want to?
Oh yeah. So thank you everyone for being in community and being in space with each other. I love the fact that we're able to make time to come collectively together. And I think that's always a great treat to know that we are connected to each other through, our Asian Pacific Islander diaspora, but also through, talking about what is well-being, what is our emotional health look like, right? What does our collective healing look like? So we really appreciate that. And then this is all recorded, so folks could come back to it, or if you missed, if you're only able to join one of the panels, you're able to hopefully watch the other ones once we have that set up. What's coming next? Okay, so for folks who are here for continuing education credits, that will be posted on our website. I believe you have to fill out some sort of link to get those CEUs. We are meeting in person, so if you are here in New York, please join us at 2:15. 2:30 is when we're starting, and the link to the building, and I'm gonna copy and paste something, but I believe it's in that link that Lynn posted too. But we will be in this building, and then we will have some workshops, some panels around mindfulness and dance as a form of healing, and a reception with some goodies and foods, right? So if you can, please join us in person. If you have any questions, you can email us. I believe there is something there for you to connect to us if you need to find your way. But that's all. Thank you again so much for coming together with us. I look forward to seeing some folks in person, and if not, still virtually online to connect in some kind of way. So I believe folks are already sharing some of their information in the chat, so we can definitely collect that as well. All right.
Okay. Thank you.
Thank you, everyone. Thank you.